Welcome to the Difference of 13 podcast, where we make a difference by doing it differently.
Hey.
Well, we got one word out of her.
Chris says I have to do the introduction because it makes me feel awkward. And he likes for me to feel awkward.
And we're 15 seconds in and you still haven't done the intro.
You got to give me a minute here.
All right.
Okay. So welcome to the Difference of 13. This is Chris. And I'm Teri. And we're going to be talking about back pain today. How to fix it yourself so you don't have to go to the doctor.
Yeah, we're super excited to have you guys with us today. Before we go any further, I would like to ask everybody to give 5-star reviews for Teri for her intro.
Yeah, because that was fabulous, right?
And any plugs you'd like her to make, any tips. Our mission as a community needs to be to get Teri comfortable and excited to do a intro.
Well, just being on camera, that's...
Well, we achieved that about 10 weeks ago.
I'm still not comfortable on camera. No. Can't you tell?
Well, we're today, guys. We're gonna be hitting on some of the most common injury, some of the tips really on the most common injury that people in the United States and around the world deal with, and that's back pain. We're going to be talking about how here in our business and just with our online resources that we can hopefully help you do it yourself and take care of your own back pain, so you don't need to go through the medical maze that is healthcare. And hopefully address most of the issues yourself. But in the case that you can't, we will also be talking about your different options and kind of best ways to get better quicker so you can get back to your life. Did I miss anything?
No, I think that's... Yeah, I mean, for a while, years ago, it seemed like back pain was something that happened to older people. And now I'm hearing it from kids, from carrying those gigantic backpacks with 75 pounds of books in there, that you're having kids in high school complaining of back pain.
Yeah, I think
that's not okay.
Yeah, and I think that's a great point, Teri, that this episode is going to be for really all ages. So if you're a parent and you have young kids, I have 10-year-olds coming in here, golfers, just from repetitive use that have back pain, as crazy as that sounds. So, whether you're a parent of a young kid, whether you're 75 years old and listening to it for yourself or anywhere in between, we're going to cover the gamut here on back pain, most common causes, things to look out for, how to actually self-diagnose to a degree, a little bit more accurately than Google, hopefully. And
hopefully,
we'll see. And so, without further ado, I think we might as well
just jump right into
it. So, have you had back pain before? Let's start there.
Remarkably, that is the one area of my body that I've really not had a whole lot of trouble with, which that's pretty phenomenal. But I have had some back pain, and it's that, you sleep wrong or you've worked out in the garden too much. Not that I ever do that, but some sort of overuse, and you wake up in the morning and it's like, I can't move. I feel like I'm 100 years old. What should somebody do when they wake up in the morning and their back is all locked up and tight?
Just to digress a little, that comment always makes me wonder, what does it feel like to be 100 years old?
I'm pretty close to it, so I'll let you know in a few weeks.
Okay, well, we now know Teri's true age, everybody. Feel free to send birthday gifts.
I like chocolate.
But no, seriously, getting back into it, I think definitely, I personally have experienced back pain since I was a little kid. I have what's called spondylolisthesis. So say that 3 times fast. But basically, in my lower lumbar area, one of the vertebrae, they're kind of like almost slipped forward a little bit. So I had terrible back spasms in like 6th grade playing basketball. I'd missed games, and so I ended up having to do lots of different corrective exercises and whatnot to maintain it. Nowadays, it just makes me look like I have a really big butt, which my wife doesn't necessarily mind, I don't think.
Okay.
It made a lot of sense when somebody in college, we were at a party and somebody put a drink. No, I'm kidding. They didn't put it on my rear end. But no, I think, there is a definite structural change that I have just naturally that led to some back pain. So I've firsthand experience with it since I was really, really young. And then obviously now that I'm a therapist, I've seen it for the past decade in many of its different forms. And I think there's different types of back pain. When you've had yours, has it been achy, sharp? Like, how would you describe the pain that you've had?
I've had waking up with back spasms where it just feels like somebody is cranking down on all those muscles super tight. And that would be like low back. Upper back, it's more from hunched over the computer. It gets sore, kind of achy.
Yeah. So, and I think when you're trying to evaluate your discomfort, so particularly with back pain, I think the first question that I always ask somebody is, first, number one, where is it? And then number two is, can you describe it? And I will always say, is it sharp? Is it achy? Is it shooting? Is it burning? And I think based on a lot of descriptive words, there's actually some interesting studies in the medical community that talk about, I forget if it was 75 or 80% of diagnoses can be made just by the subjective, which basically means if I ask you the right questions, most of the time I can diagnose you correctly. So I think when you're asking yourself those questions, if you are going to give your pain labels such as shooting or burning, particularly from your back, if it's going down your leg, then you start to think, is it more nerve related? If it's more achy or sharp, that kind of nasty spasm, do you tend to think more muscular or more soft tissue? Now, there are instances where the nerve can cause those muscle issues. That's something we can talk about down a little later. But I think, at a very superficial level, you're either, is it sharp and achy, or is it, shooting and burning and searing pain? In which case, those tend to be more nerve based. I think when you're talking about your leg, now this is where it gets tricky, because people talk about, I got the sciatica.
Yes.
Everybody's got the sciatica, just like I got the bad cuff, everybody has got sciatica, and then basically that just has become a blanket term for pain down their leg, and that can be just into their butt. It could be all the way down into their big toe. I think there is a bit of confusion, and a lot of times it gets misdiagnosed. And this is, honestly, I'd say 90% of the people that come in that say, I've had back pain for the past 5 years, I've seen X amount of therapists and doctors, I'm never going to be pain-free. My friend told me I just need to at least see you, and it's free, so what the heck? And they come in and, within 15 minutes, they leave pain-free. But it's because nobody actually looked at what are called muscle trigger points. And muscle pain can refer, I want to make this really, really clear, muscle pain can refer and appear like nerve pain. It can refer down your leg, particularly from the glutes, which are the muscles in your butt. You have 3 glutes. The gluteus maximus, which mine looks really big because of my back. And then you have your gluteus medius and your gluteus minimus, which are kind of on the sides, over towards your hip bone. And those oftentimes...
And they go up really high.
Yeah, so if everybody who's listening or watching right now, if you put your hands on your hips and kind of go up to where the top of your hips are, and if you're watching on YouTube here, you can see my hand is almost at the level of the table. It almost feels like it's up into your back. Everything below your hand, kind of top of that hip bone, or below your hand that's lays on top of that hip bone, is your butt. So your butt goes really high up into your, towards your back. It's actually technically your hip, but most people would call that their low back. And when those muscles get spasms in them, they can refer pain down into the side of your calf, down your leg. They do not typically refer into your foot, though. So if you are feeling discomfort in your foot, numbness, tingling, those are some other key words that make you think nerve. But if you're feeling down into the foot, you are going to tend to be a little bit more concerned about a nerve issue,
right,
or a disc issue, coming from your back down there. But if the pain is not into your foot, there is a chance it could just be coming from trigger pointing. And with trigger points, simple definition: think of spaghetti parallel on a plate. So if you're watching on YouTube, you can see my fingers here. If I took a fork and I stuck that in the middle and then I twirled it, all that spaghetti would get all twirled up. And even though the spaghetti may still be 3 inches, and now it only looks like it's an inch from end to end because it's in a twirl. That's a simple way of thinking about a trigger point. When you release a trigger point, whether it's with dry needling or manual techniques, and the trigger point twitches and it releases, it's basically like that spaghetti falling off the fork. And when you do that, if the pain is being caused by trigger points, the pain immediately goes away. It has been an absolute game changer for us clinically, yes. But for so many people with back pain, it's like don't want to say necessarily the magic bullet, but in some cases it is.
Right.
So I think the first thing when you have back pain, you want to disseminate, is it sharp or achy, or is it nervy, kind of, burning, shooting, any numbness or tingling? That'll typically be more nerve related. If it's down into your foot, it's probably nerve related, and that could be because a disc has bulged some and is pushing on the nerve. It also could be at the nerve root, where the nerve comes out of the spinal cord in your back. Could be from there as well too.
What about people who go to the orthopedist and they do X-rays, and they're of a certain age, and there's some disc degeneration? Why do so many of us have these disc issues? Is it just because around a certain age your discs start to wear out, or is that something that needs to be surgically addressed?
In most cases, that's just getting old, guys.
If you get an X-ray and you're over, what, like 50?
I think it's like 30.
Oh, okay.
Yeah. You start having, they call it DDD, or degenerative disc disease.
And you see that on a radiology report and you think, oh my God, this needs to be...
I have a disease.
And it's, there's something wrong with my disc. I have to have surgery. No, it's just you're getting older and you need to take better care of yourself.
Well, and I think we talked the other week about shoulder pain. We talked a lot about the amount of extra money people spend if they get imaging first. There's lots of research out there that what was called or is called the structure pain model. And that's still what's taught in a lot of medical schools, PT schools today, is that if you have pain in your back, it's because of a back problem. So if you have pain in your back and you get an X-ray and you have degenerative disc disease, which basically just means if you think of a hamburger and somebody took the meat out, so you got bun on bun. Nobody likes that, right? You want the meat in the middle,
right? Unless
you're vegetarian, in which case, I don't know, tofu burger. But basically the disc is a fluid kind of shock absorber, as it were. And so if that disc is not as shock absorbing as it once was, or
squishy,
basically you don't have as much space between the bones, then that's called degenerative disc disease. Basically the disc is degenerating. There is absolutely zero relationship between having a degenerative disc disease and having back pain. If you did, you can take an X-ray or an MRI of 10 people, of 100 people, and if you find all the people that have the same exact levels of degenerative disc disease at the same exact spots, you'll probably have, if let's say 50 of them, if you have 50 of those people, most of them are going to experience discomfort. If they're experiencing discomfort at all, they're going to experience it differently. Some may feel more nervy, some may feel achy, most probably don't feel a thing. There is very little research to support that diagnosing somebody based off of imaging is accurate. And I think, unfortunately, that's why we have an only 50% success rate with back surgery. It's the worst outcomes for orthopedic surgery. And I think a lot of the times it's because we get this nondescript back pain. It's like people say, it just kind of hurts. It just kind of aches. It's sore. And they go to therapy. And unfortunately, a lot of the times the therapist just gives them exercises. They maybe don't address the actual quality of the tissue. So they miss all those trigger points. And then it just keeps aching no matter how many bridges they do, no matter how many band exercises and clamshells they do. And then, at the end of the day, they have degenerative disc disease, or they have a little bulge in a disc, and so they end up and go and do a fusion or something along those lines, and sometimes it doesn't work. Now, there certainly are times where it is appropriate.
Absolutely.
But I think we do need to get away from this structure pain model where we take an X-ray and MRI and, I got the degenerative disc disease. I need back surgery. I got a bad back. Most people who have that don't have any issues.
Right.
And they've even done studies with herniated discs in people who do not have it surgically repaired. If you just wait 2 years, it scars up and heals, and the people don't have any pain. So
back surgery is not an easy surgery.
Right. So, I'm not saying that you never should ever consider surgery. What I'm saying is it is an absolute last resort, particularly when we're talking about the back. And you need to make sure that you start off with understanding how you describe the pain is going to tell clinicians a lot about how they might potentially treat you. And please, this is my pet peeve, check the tissue. check for trigger pointing, check for referred pain. Just because your back hurts, and in this case, and honestly, in most cases in the body, wherever your pain is, that's probably not where the problem is. That's probably just the area that's compensating and overworking for the other areas in your body that should be doing it. So you got me on my soapbox. I totally forgot where we were going with that.
Sorry. I dragged you down a path, but I think that's an important path because I've had friends, excuse me, who have gone and had x-rays and sort of ended up going down that road, and some of them had back surgery and it didn't go so well. So I think that's kind of important to share, that should be a last resort.
Yeah, and I think when you're looking for a surgeon, you want to find that surgeon who understands that they are the last resort. You don't want the surgeon you walk in and first visit, they don't even ask you if you've tried any conservative measures. They're like, all right, yeah, let's go, let's do it.
Surgery's great. It'll be fantastic.
And they mechanically make you feel, they make it look better on x-ray, and they kind of kick you out the door, and right. the thought is, well, I did my job.
It's up to you now.
It's up to you.
So, if we don't want to have surgery, what are some of the things we can do way before that?
So I think the first thing is you check out the links in this bio of this episode for some back fixes that you can, we call it your DIY fixes, some soft tissue things that you can do. Most back pain, particularly pain where you wake up in the morning and you're just sore, achy. You were playing golf and on the 12th hole your back locked up on you. You were working out. You're doing testing at your gym and you don't want to stop even though the back is kind of spasming. You can't move for the next week. Most of those issues come from the glutes locking up. So you get a ball, you sit on your butt, you find the spot that hurts the worst, and you release those trigger points. So first thing you do is you watch the videos about how to do that correctly. It's not just rolling up and down on a foam roll, despite contrary belief. Yeah. Or contrary to common belief. But I think after that, you try it yourself. You try for a couple of days. You can't fix it. I think the next step is you need to go see a physical therapist and let them help you make that diagnosis. There's lots of clinical tests that we can do, or you go see a chiropractor. I think in both professions, I get this question all the time about back pain. What do you think about chiros? Yeah. There's like this, I don't know. Who was it? Rocky Balboa versus the Russian. Drago was his name, I think. Right? It's like PT versus chiro, right? Like we don't get along. I think there are phenomenal chiros out there, and I think there are phenomenal therapists out there. I think if you get phenomenal on both sides in the same room, you probably couldn't tell the difference. I think there are also absolutely terrible chiros, and I think there are absolutely terrible, equally as terrible PTs. I think PTs as a whole, we have the bad rap of we give you 30 exercises, then you come back to the clinic and we have you keep doing those 30 exercises and we charge you for it. I think chiros have the stigma of I'll see you twice a week, crack your back, wham, bam, out the door. Maybe we'll put you on a little massager machine that I can bill you for, and then you're out the door there. So I think in both professions, there are terrible clinicians that unfortunately give a bad name to it. I think there are a number of chiros, particularly locally. There's a couple that I love that are just phenomenal. We refer back and forth and work together with patients. I think you need to find the person who understands, and this comes into when you're finding the right clinician. Right. Ask them what their treatment approach is. Ask them.
And we did a whole podcast episode on finding the right clinician.
We did.
I don't know if you can find the episode number real quick. But yeah, that being able to vet out who you're going to see is so important because you're right. There's great orthopedic surgeons. There's horrible orthopedic surgeons. Same thing with PTs, chiros, massage therapists, any of those folks. You just have to find the right one.
Yes, it was episode.
We can put it in the show notes.
Episode 11.
Yes.
About the continuing education. So, definitely listen to that in terms of how to find the right clinician. But I think you need to ask them, my back hurts. What's your approach? And you want to hear things like, I'm going to ask you to tell me everything about it. And then I'm going to check the tissue to make sure that's okay. Maybe I'll check this, your vertebrae in your spine to make sure nothing's rotated, funny. But you should leave that first session usually feeling somewhat better. Their clinician should do, let's say you can't touch your toes because your back hurts. Before they treat you, they should see how close you get to your toes, how it feels. Then they should treat you. then they should
Right.
retest that so that for both of you, you can see if what the treatment that was implemented, if that had any effect on you. Definitely don't get roped into, we're going to treat you for 4 to 6 weeks, 2 to 3 times a week, and then we'll see how you're doing. If you're not, if there's zero improvement in at most 2 weeks, the approach needs to change, or the diagnosis was wrong, or you just need a different person to see a different person. Right. But good clinicians, whether they're chiros, whether they're PTs, are constantly testing, intervening, and then retesting. They're constantly making sure that everything they're doing is getting you closer to your goals.
Right. You should.
So
Yeah, you might have some little setbacks along the way, but you should generally be going on an upward trend.
Yeah, and there should be a very reasonable explanation if there is a setback.
Mm-hmm.
Going back to
what happened and
exactly.
Yeah.
So
that initial appointment, they should be able to give you some sort of plan of what we're going to do going forward.
Yeah, and I think it'll take X amount of visits and this amount of time, and but they definitely should do that. I think that's your first step. If you can't fix it yourself, you need to go find the good PT or the good chiro near you. If you're local or we're a little too far away, give us a call. Happy to chat with you and refer you to some of our colleagues who maybe will be closer to you. We always
if they are local, we do free discovery visits.
That's right. Yeah,
30
you come
minutes,
on in for free.
Come in and chat with one of the therapists, and they can do some of that initial assessment of what's going on with you and start to give you an idea of, is this something that we can handle here, or maybe you need to go see some other professional.
Right. And we can even give you a nice tour of our big studio here.
Right.
That's an added benefit. We don't give that
Right.
to anyone. You got to mention that you're a listener to the podcast or watching us on YouTube.
Right.
But
I might even throw in an autograph for him. Yeah.
You heard it here, folks.
Because, that's going to be super valuable never.
But then I think, you go to the PT chiro, I think they'll be able to tell you very clearly if they think they can help you, or if you need to go see the next level up, which may be a neurosurgeon, orthopedic surgeon. It may be a non-operative ortho if they think maybe just a steroid injection of some sort may help to get any inflammation down that may be there. And then they'll also be able to make the recommendation, you know what, I think we do need to go get imaging. I think this is a case where that would be appropriate and that would be helpful. I'm concerned because of X, Y, and Z. But I really would strongly recommend that people don't go to that first. Let the PT or the chiro or go see somebody who can try to assess you and treat you conservatively first, and then let them make that call. Save yourself the money, because as a PT, if you come in already having the MRI, it's probably not really going to change my treatment approach. No. If anything, it's just going to be confirmation of what I think or don't think. But even if you come in, I've got a bad herniated L3 or L4. If your symptoms don't match up with anything related to that level, we're probably not going to necessarily treat the disc.
Right.
If you say I've got a bad herniated L3, L4, and your symptoms match those exactly, and maybe we're going to do some McKenzie extension. We'll do whatever the approach is that we're going to take. The approach probably would have been the same without the X-ray or the MRI. We just know for sure that it is there, and that's in a lot of cases you don't necessarily need that right away.
And MRIs are not inexpensive.
No, they're just a couple grand.
Just a couple.
Yeah. All right. So what else? Where are we at now? So they've seen the PT, the chiro. They didn't get any better, so then they went to the doc. The doc you want to go to the one that's making sure you're doing the conservative and wants to cut on you into the last option. Hopefully, most of you don't ever get there.
Right.
Hopefully, my hope is most of you are fixed in the DIY phase, or you're fixed in the phase where you go see your local chiro or PT, whoever the good clinician is. I really don't care what, I don't know if you say denomination they are, but what profession they are.
Right. I think that's a better word.
Yeah, that's probably a better word. But what we do care about is that they understand the body, and chiros tend to come more from a spine out focus. PTs come from a little bit more from an out to spine focus. At the end of the day, we should get to the same result, and it's the same human anatomy, it's the same person that we're treating, and you want to make sure you challenge them to answer your questions, ask intelligent, informed questions, and don't take the "we'll see in 4 to 6 weeks" answer. If you're not getting any better in 2 weeks, it's either the wrong diagnosis or the wrong treatment.
And not necessarily saying that you're going to be totally better, but
No,
you
but
should be seeing
should be trending, yes.
Trending in the right direction. You should be seeing some relief.
Right. And demand, test, retest. Test something that hurts when you go in, and when you come out, it should feel better.
Right. There needs to be an objective measure as opposed to just, I think I feel better.
Right. And that can be a tough and frustrating thing with back pain, is it sometimes can linger and take a while to get better. And so you do need to take objective measures. In extreme cases, I'll have patients actually journal in terms of when it's to try to identify what are the aggravating factors in their life, and is it time of day, is it certain activities?
I mean, I've done that because you get busy and it's hard to remember. Did it hurt yesterday? Did it hurt more yesterday than it did 2 weeks ago? Because you get in that mode of it just hurts, and it can be hard to remember. Does it still hurt as much as it did before? Right. Can I now do something this week that I couldn't do last week?
Right. And I think, as we get close to wrapping up here, I do want to make sure that we talk about the most common areas. I know we talked a lot about glutes. The other two big ones, the deep hip rotator, so it's kind of down by your sit bone. So if we're sitting, if you kind of reach your hand underneath your butt and feel that little sit bone there in a hard chair, your deep rotators down there oftentimes can cause, if they get really locked up, they really kind of can cause a tightness around your central low back. And then the other one that a lot of people don't remember, or they just don't know, or they forget, I don't know, but is the psoas muscle. So,
oh yeah, that's a fun one.
That's a real fun one. But that comes up from the front of your thigh up into your lower abdomen. Basically, it attaches to the front of your lumbar spine, coming up from your inside of your hip.
And you may not think of that as causing back pain, but it really does.
It really does. It pulls you forward into an arched back, so you kind of look like me with a big butt sometimes. And it can really cause that low back to really seize up in response to trying to fight it. It's basically a tug of war. So I think those are probably the most common muscle areas that you want to definitely look at. If you're in spasm, those are probably spazzed out, and you probably need to release them, and that'll actually help some of your acute discomfort. So that you can actually go in and do whatever it is that needs to be done to totally fix it. So hopefully that was helpful, everybody. If you do have other questions or we didn't cover it, definitely let us know.
We do read the comments.
We do. That is very true. And hopefully they got a few actionable tips here.
I think so.
They'll definitely we got the links in the bio for you for those kind of DIY back fixes for the most common ones. If you can't fix it with those, we also will have a link to set up a free discovery visit if you're local, or a free discovery call if you are anywhere else in the world. So it doesn't matter where you are. Skype is free, and we do a lot of that. So so wherever you are in the world, we want to help you. We hopefully you'll take advantage of these great free things, tips, I guess. And anything we want to tell them about for next week?
What body part are we covering next week?
I was thinking we'd go knee.
Knee. Oh, yeah. That's what brought us together.
It is. It's our origin story.
Yes. Oh, it was fantastic.
Yeah. Our beginning was your knee.
Yeah. It's scary.
But we have to figure out a way to make a cool cover on for that episode.
Yeah. We'll work on that.
And your intro.
And my intro. Yeah. We're going to be on episode 5,000, and I'll still be struggling with the intro. It's just not my gig.
It isn't. You want to try reminding people where to find us?
Where can they find us? On YouTube.
Yep.
iTunes.
Yep.
Anchor.
It all goes out wherever they listen. You're going to be listening to about 15 things.
Okay,
so wherever you listen to get your podcast from, obviously you can find all of our episodes there.
And if you give us 5 stars, that will help other people find us. And
exactly.
You can also send links to your friend. If your cousin's got back pain, send them a link. Tell them to watch it.
Definitely, yeah. And obviously we're on Instagram, Twitter, Facebook, all at Par for Success. You can always check us out as our website, parforsuccess.com. Lots of free information for you there as well. And on that note, I think till next week, everybody. Thanks for listening.
Bye.